Hello, and thank you for joining us for our sports therapy talk today. My name is Laura, and I am the Student Engagement Officer at Marjon, and I'm going to be hosting the session. Presenting today, we have Sarah Catlow, who is our Senior Lecturer and Sports Therapy Programme Leader. We also have two student ambassadors with us, Gemma and Hannah, who are going to help answer any questions that you have for us. And to ask your question, please head over to the question bar, which is now live. This looks like the speech bubble with the question mark in the middle. I'll be asking all of your questions to the team at the end of the presentation. So whenever you're ready, just send them in. But for now, I am going to pass you over to Sarah.
Thank you, Laura. Welcome. A completely different way of doing this, but hopefully I can give you all the information that you need about the sports therapy degree here at Marjon. So Marjon is a very small university. We pride ourselves on our small groups. So with our groups, they are very, very tiny for our practical sessions. We only have no more than 16 students per group. So we've got a very small teaching team as well. So we are kind of like family. So we know each other very, very well within the degree program. So I put up my contact details here. So please feel free, if you don't want to ask a question or when this presentation is finished, please send any questions that you have across to me. So my email address is on there. We are very active on social media right now, so we're putting up lots and lots of stuff. So we have our Twitter account. We have a rehabilitation clinic Facebook page. We also have a private Facebook page for our students, so please feel free to join that if you wish. And we also have Instagram, so you can see what we're doing now, you can see what our students are doing, and you can see all the exciting stuff that's involved in the degree. So our degree is accredited by the Sports Therapy Organisation, the STO. We are also accredited by the FHT, which is the Federation of Holistic Therapists, and we work quite closely with the CNHC, which is the Council of Natural Healthcare Council. Within the degree, and I'll talk you through the degree and what we teach in every year, but we actually offer lots of extra qualifications within the degree as well. So they're embedded, so you don't just come out with a degree, you come out with some extra qualifications. So we have gym instructors qualification that is put in. We also have personal training qualifications, and our soft tissue module is FHT accredited. So that means at the end of year one, you can actually work as a sports massage therapist and start building your kind of client base within the area of sports therapy. So in year one, we have lots of different modules to obviously engage and to enhance your clinical skills. So we work with engaging with learning. So this is where you learn how to kind of write academically, how to reference, how to research information. So that gives you the building blocks to work and kind of get your assignments up and ready. We do psychology, so psychology is really important when we work with athletes. We're normally one-on-one with athletes and how we work with them and motivate them during their injuries and their rehabilitation. We do functional anatomy, so that's really hands-on. We learn every bump, every muscle, everything about the human body, so it allows you to be able to diagnose injuries correctly. We look at physiology. So one of the main questions I get asked is, what is the difference between a sports therapist and a physio? So we both can diagnose MSK injuries, we can rehab them and treat our patients, but what makes us slightly different is our physiology knowledge. So we can actually rehab an athlete back up to, you know, Olympic standard, if you like. So we have BASIS accredited labs at the university, and we have some fantastic equipment to work with our athletes and to really get them back to sport. We have our soft tissue therapy module, so you're actually hands-on with patients in semester B, so that's in January at the end of year one. So you could be treating a staff member, another student, one of our professional athletes, We will talk you through how to treat them. All the clinics are really supervised. But when you pass that module, you can then obtain FHT accreditation and obviously work as a soft tissue therapist. We also look at musculoskeletal assessment. So we look at how to diagnose an injury. So we look at joints, we look at how to test them. How can we work out what is wrong with that athlete? So even from year one, we're really hands-on with our teaching, and you're really hands-on with patients, because that's a really important skill to have as a sports therapist. In year two, we do research methods. So we kind of get you ready and prepare you to get ready for your dissertation in year three. So how do we research? What are the areas that we look at? And we also have engaging with employability. So you do 100 hours of work placement in an area that you are interested in. So we have lots and lots of employers that work with us. So we work within professional sports. So we have links with Plymouth Argyle, Plymouth Raiders, Torquay United, Exeter Chiefs, Exeter City Football Club. We have links with NHS clinics. We have links with military. So you can really choose where you would like to get your experience with that. We introduce you to exercise coaching and rehab. So this is where you'll get your kind of personal training qualification with our athletes. We look at manual therapy of the spine. So when you work in private clinic, lots of our patients have back issues and spinal injuries. So we teach you how to assess the spine, how to treat it. Then we have injury treatment modalities. So we teach you how to use all our equipment. So ultrasound, therapeutic and diagnostic, laser, inferential, anti-gravity. So we teach you how to use all of those and when we use them with patients. We also talk about pathology and clinical reasoning. So we look at how a tissue heals and when do we treat, when do we do certain things with our patients. We also work with you pitch side in year two. So you'll be looking after some of our buck squads and getting pitch side experience. In year three, you will submit an honours project. So that's 7,500 words of a research topic of your choice. You get given a supervisor with that as well. We look at diagnostic, rehabilitation and injury management. So we teach you how to rehab. So we will go through different injuries. How do we rehab them? So after we diagnose them, how do we rehab them? How do we treat them? We've also had a strength training, conditioning and rehab. So some of our rehab is linked to S&C. We have some excellent S&C facilities at the university. So we will teach you those skills working with our patients. We have injury biomechanics. So again, we look at athletes and how do we prevent injuries from happening. You know, sometimes when an athlete is injured, biomechanically they will change. So how, you know, what kind of equipment would we use? So we use 3D kinematics, we'll use isokinetic machines, we use force plates. So again, we teach you how to use all of those and to really look at how we can treat an athlete even if they're not injured, so we can change biomechanical issues, and obviously with prehab and after rehabilitation if they have a few problems. We do clinical experience. So you're in our commercial clinic. So we do 200 hours with you in this module. We have our own commercial clinic, which sees a variety of patients, anywhere from your little old ladies all the way up to our professional athletes. So within sports therapy, you're in clinic with us for 125 hours, which is timetabled. And then the rest of those 200 hours, again, you can work in another environment. So whether that's a sporting environment or an NHS environment. So we really encourage you to get those experiences and to network. So overall, in the whole degree, you get a minimum of 400 clinical hours. Some students will get more than that. So I'm busy marking right now, and some students have actually gained 600 clinical hours with us at Marjon in a variety of environments and getting lots and lots of different experiences. So as I said before, we give you a minimum of 400 hours, which are timetabled. We give you lots of opportunity to gain lots more clinical placement opportunities here at Marjon. As I said before, we work with lots of professional clubs. We're very lucky down here because we have the niche with all the clubs. Lots of our students will work with Plymouth Argyle Football Club. They will work all the way from first team all the way down to academy, men's and women's teams. We look after Plymouth Raiders, so we will look after them courtside. We look after them on game day, all their warm-ups, their training. They're in clinic with us all the time, so you get to really meet those players and work with them throughout your whole 3 years. We also work with disability sport as well. So we have some students working with our wheelchair basketball squads and some of our Paralympians and para athletes as well. So that's quite exciting. We have links with all the kind of local sports clubs in the area. So we work with Devon Services Rugby Club. We do a lot of charity work. So we look after students, we look after athletes at Plymouth Half Marathon, the 10K races, some of the cycling races as well. So we will look at, students will go and engage with that as well. So it's a great experience to work hands-on in that environment. As I said before, we look after all Bucks squads on site. So you'll be allocated a Bucks sports squad to look after and to work with. So lots of different experiences with that. One of my main questions I get asked is, are there jobs at the end of this? Yes, there is. So 10 years ago, not as much, but now there are so many jobs coming up in this industry. So anywhere from NHS to military, to private clinics, to sporting teams. Here at the university, as I mentioned before, we offer lots of different work placement opportunities. So within professional sport, within national sports organisations. Again, we work with most local sports clubs and private clinics. We work with the armed forces, so we look after their field gun teams, so you have the opportunity to work in there. We have lots of NHS clinics, so at the university we have NHS clinics in pain, cancer, pre-rehab, so lots of different opportunities to work in, and community-based exercise rehab settings as well. So lots and lots of different opportunities for you to really engage with here at Marjon. So Marjon, we have, as I mentioned before, we have a very, very small staff team. So there are 3 of us who are full-time and 2 part-time staff, and we have 2 clinic supervisors as well. So we work very closely with you. Our commercial clinic is open till 8 p.m. So we are the only kind of degree on site where you can get access to staff from 9 a.m. till 8 p.m. So you can use the clinic to work with, to treat patients, but you can also book out beds to do study or to ask questions with us. So lots of different opportunities with that. As I said before, our class sizes are quite small, so our practical class sizes, we do not have any more than 16 students per staff member. And in year 3, it's normally 5 students per staff member in commercial clinics. So you get lots of support within that. We have a very strong personal development tutor kind of network, so you get given a personal tutor. And we work with you throughout the 3 years. So whether it's dealing with problems that you have, or kind of doing a career plan, or introducing you to people to help you achieve what you need. So it's a very exciting degree, very hands-on with that. There are other live talks that are going on as well that may interest you. So there are obviously guided campus tours, sports at Marjon, how to make an application. So please try and engage with those as well. I'll pull out my contact details again. My information is on the website if you obviously don't write this down. But please feel free to drop me an email, or we can organise an online face-to-face talk as well. And then is there any questions that you may have?
Perfect. Thank you, Sarah. If we could go straight to Gemma for this one.
Yeah.
So Sarah touched upon it there, and we're talking about how Marjon is a small university, a small community. But could you just give us a little bit of your experience of studying in a small institution on this course?
Yeah. So I think it just helps you out so much, because I think in a bigger university you don't necessarily know where to go for help. So I think because you get to know the lecturers as well, you sort of know, you know, you can go to your personal tutor, you know who your module leaders are, who possibly know more about the particular module you're doing. So I think that's really helpful, that you can sort of know where to go for help and they get to know you as well. So even if it's not, you don't want help about the course, it's something else, they'll always try and help us, which I think is really useful to have.
Perfect, thank you, Gemma. And Hannah, if we could come to you for this one. So Sarah's mentioned about the amount of work opportunities that there are for someone studying on this course. And is there anywhere that someone could get support for experience, for example, on campus?
Yeah, so your personal development tutors will be able to help you with that at any time. But we also have futures at university as well. So they're just a small team and you can drop in at any time or book an appointment. And they're really good at helping you come up with a CV, applying for jobs, and just knowing, where to go.
Perfect, thanks, Hannah. Sarah, if we could come back to you, what is the split between practical and theory?
We do more practical, if that makes sense. So we might have lectures that say they're theory lectures, but we're very hands-on practitioners, so we always turn theory lectures into practical lectures. We do spend a lot of time in clinic with the students, so I would probably say in year 1 it's a 50-50 split, and then as we get up to year 3 it's about 75-25, so more practical in year 3.
Brilliant, thank you. I'm just going to quickly refresh this question bar here. There is a slight delay, just to let you know. Perfect. So could Gemma, if we go across to you, back to you. So what are the unique selling points of sports therapy? So what caught your attention to want to study at Marge on this course?
I think for me, like obviously as we've already spoken about, the really like small knit community. So you sort of know where to go for help. I think the modules as well are really helpful. So all the modules I've done have been really specific to stuff I've done on placement as well, and have sort of helped me link everything together. So I've sort of understood it more as I've gone on, because sort of in first years you just get kind of a lot of information, but then as you go on, now I'm at the end of second year, you sort of all see how you can like piece everything together. So I think as well for me it's the modules that they've chosen, and as well the extra qualifications that we get. So like your personal training, your FHG, like your gym instructor, that's all sort of extra things you can use after university. So it's not necessarily, you just have to practice in a private clinic. You have got other things you can do as well.
Brilliant, thank you, Gemma. Sarah, if we could come back to you again. So the question is, what are the entry requirements for this course?
The up-to-date entry requirements are on the website. I think it's BCC for A levels. I don't know what that works out into UCAS points. But if you go to the website, it will give you a breakdown on the entry requirements. If you don't have the entry requirements, all applicants that don't hit that are sent directly to me to have a look. So if you've got extra qualifications, and sometimes I have a chat with the student to do that. So we do that with a lot of mature students that maybe don't have that, but lots of life experience.
Perfect, thank you. We have a question about placements. Hannah, if we could come across to you for this one.
Yeah.
Let me just get the screen up there. So you have a lot of freedom in finding placements that you want experience in certain sports. But what are the likely chances that you are able to work with one of our great partners, for example, like Argyle?
So there are lots of opportunities over the 3 years, but what I would say is try a bit of everything. So you might go in first year knowing exactly what you think you want to do, but maybe just try a bit of everything, like go into that clinical environment on like one-to-one, working with clients, go out on pitches and do pitch side, work with a professional team, just try a bit of everything, because you might surprise yourself and find something that you really enjoy. I did my placement with Raiders and that was really, really good. So we did their morning training and we were courtside for their games as well, which was a great opportunity that not many universities will be able to offer, which is really good.
And is that available from your first year if you go seeking for that?
I think you might have to get your clinical hours first, Sarah.
Yeah, I'll answer that. To look after the squad, normally we ask year 3 students, but year 1 students can shadow. So they can go and watch our year 3 students work. And then some of our year 2 students will go in and do work placement with them. So we actually encourage year 1 students to go and shadow our, year 2 and year 3 students, so they can still get that experience and obviously enhance their clinical knowledge. And it gives them time to work with other students and see where that degree can take them when they go through. So yes, you can in year 1, but you will be supervised.
Brilliant, thank you. Sarah, if we could just stick with you on this one, would you be able to tell us a bit more about the facilities that are available?
Yeah, so we are very, very lucky at this university. So we have a 12-bed commercial clinic for the students to work in. So that is open, I think it's about 41 hours a week. So students can use that clinic to, obviously we treat the patients, you're timetabled in there, but we encourage year 1s to come in, again, shadow the rest of the students, or to even book a bed to work through some of the lectures and practical sessions that we've gone through. And again, help is always available because we either have a supervisor there or an academic staff member. We also have a teaching clinic that has got 21 beds, I think, which is up on main campus. So we have that, and we also have a smaller room that we share with the osteo students that has about 15 clinical beds in. So we do most of our practical teaching up there. We are very lucky with our equipment. So we have, ultrasounds for every bed. We have laser, inferential. We have anti-gravity machines. We have isokinetic machines. Also our lab that we use for rehab and testing. We have an S&C section in there. So students will have S&C sessions within that environment. We also have our physiology lab where students will use as well, and we have a biomechanics lab. So our students have the opportunity to use all of those, and they are timetabled in. So we're very, we say to students, have a go at everything. Try every piece of machinery, really gain those experiences. So even though we're a small university, we are very, very lucky with the facilities that we have here.
Brilliant, thank you. Let's have a look what we've got here. Gemma, if we could come back to you.
Yeah.
You can just grab your screen up there. So talking about the contact hours, would you be able to give us a bit of a feel of what the course is like? So what would your general week look like, for example?
So it sort of varies, but I would say in first year I definitely had more contact hours than in second year, because obviously in second year you do get given time where you can go out and get placement. So I think that's good that you do have that time to do that. And usually they've tried to give us sort of the same day off a week. So for me this year it was a Thursday, I had that same day off and I'd go to placement each week there. Also, we nearly always get Wednesdays off. I think I've had maybe like 5 or so lectures on a Wednesday, because that's when the Bucks Wednesdays at the University League happen. So I think that's really good, because if you want to do pitch side working with the teams, you have that whole day where you can also utilise that as well. So I would say I'm probably usually in sort of 3 days a week kind of thing, and then you sort of fit placement around that. So you have a lot of free time, but you are expected to sort of go back and like go over the notes, which I think like is fair enough. We need to do that, because I think if you do it in first year, like I found it so much easier doing that. Now I'm in second and third year. So I think that's really good, just to keep going over it and revising it.
Brilliant, thank you. So we at Marjon, we have quite a lot of mature students and students that return to study that come and study with us. And I was just wondering if there is any academic support, like if there's any study skills or anything like that available to them. Hannah, if I could swing that your way, is that all right?
Yeah, so in induction week, they'll catch you up to speed with all the referencing and academic writing that you'll need to know. And then there's always help available if you are stuck or if you are needing an extra bit of help, either with the library team or your personal development tutor or any of the staff members around.
Brilliant, thank you, Hannah. I am just going to have a quick refresh. I haven't seen any new questions come in. So just a reminder to attendees, there is a slight delay. So if you're sending in your questions, give it a couple of seconds before we'll be able to see it. But I'll just give that a quick refresh now. Okay, well, I'm not seeing anything else come in just yet. Give it a couple more seconds. Bro. Okay, well, I just want to say thank you once again for choosing to join us this morning. If you do have more questions, please get in touch with us at visitus@marjon.ac.uk. I will post that in the question bar in just a second as well, so that you can see that. In the meantime, stay in touch. Please do visit some more of our live talks that we have going on this week and next, and please stay safe.